Well, we know how difficult this past year has been. The pandemic has taken a toll on all of us, whether it be financially, emotionally, or even physically. And it's not just adults. Children and teenagers have also been forced to adapt to so many changes. This morning in our Health Matters segment, our health partner Holston Medical Group gives us some insight on the impact of COVID-19 when it comes to the mental health of our children. We are joined now by HMG Pediatrician Dr. Danielle Street. And Dr. Street, thanks so much for taking the time to join us today.
Hi, thanks for having me.
Well, certainly such an important topic. I know as adults, we keep trying to learn and change this year, but it also takes a toll on the kids who have had to do just as much adapting.
Right. It does. It's been harder on children than I expected. If you can think about how adults are affected by COVID-19, you can probably only imagine how much more children are affected by it. They're still growing, their brains are still developing, and I feel like they're trying to process this change in the world without totally understanding it. So it's been a big adjustment and a lot of changes for those minds to grasp and understand. And children don't always know how to express themselves as well as adults do. That's part of growing up and something that they learn. So they're not always going to tell us that they're feeling stressed or they're feeling worried or anxious. They're going to tell us in other ways, and we have to dig a little bit deeper to find out exactly what's going on.
Yeah, sometimes it seems like our kids want to protect us. Right. Yeah. Are there guidelines that you guys follow when it comes to assessing a child's mental health?
Yeah, there are. The American Academy of Pediatrics provides us with some guidelines which we can use. There's some screening forms based on each child's age that we can use, and then just some general guidelines of things that we need to make sure we're assessing. So this is a really important reason to make sure that parents and caretakers are bringing their children in for their well child checkups. At a checkup, we do the basic things like make sure the child is growing well and healthy, and we give them their immunizations, but we also screen their mental health. And as the AAP advises us, this goes as simple as making sure there is housing security and food in the home, but also digs a little bit deeper into social aspects, extracurricular activities that children are no longer getting, not being able to hug their friends at school. And social interactions are so important for a developing child that we need to see how missing out on some of those things is affecting them. Yeah. And also other resources that a child gets, such as occupational therapy and physical therapy, speech therapy, things that they generally get in school. Some children are not getting those anymore because they're not in school regularly, and so then they may fall behind developmentally, and these are things that we check on at our well child checkups to make sure that we can get those children the resources they need.
Yeah, there are so many different pieces to this puzzle, and Dr. Street, I know as a mom, it's so disheartening to think that your child might be going through something and really having some difficulties. How do you know, or your advice to a parent on how we should kind of proceed with that child?
So the first thing I would advise is, if you have concerns, trust your mom, your dad, your parent, your guardian gut, and let us know. Make an appointment, come in, we'll get you in quickly, and we'll help you navigate this and see what's needed. The things you can do at home are just be there for your child, be present with your child, spend time with your child. Let them know that you're there for them and talk to them, ask them how they're dealing with it, and ask them, what they need from you. But let us know when things get beyond that. We have a partnership with Frontier Health, and they have been so wonderful to help us navigate these times when it comes to mental health. We have a liaison through Frontier Health who is here 2 days a week, and we're able to get a hold of her other days, and she is helping us get children into Frontier Health to get the mental health services that they need. She helps us get them in quickly, and she helps get them in with these specific services that would be beneficial to the child based on these specific issues they're experiencing.
Yeah, are you seeing kind of the demand increase here for behavioral health services?
Absolutely. It is, it's almost every school-age child, well child checkup that I'm doing right now, there is some sort of mental health component to discuss, whether that is the child's behavior not being as it normally was, some concerns for anxiety, depression, mood changes, a wide variety of things, but the demand has certainly increased.
And you mentioned, too, just being there and communicating with the child and kind of watching those warning signs that maybe they do need a little help. Maybe it'll help them to kind of get it out and talk to somebody who's not the parent and doesn't have that emotional investment.
Exactly. Yeah, that's what I tell a lot of parents, is sometimes getting a third party involved can be really helpful, because as much as children love their parents and guardians, sometimes there's things that they may just not feel comfortable discussing with them, and that's where we can help. And sometimes they don't even feel comfortable revealing everything to me, but at Frontier Health, with the mental health specialist, they know how to ask these questions and talk to these children where the trust is developed, and then that things can get better.
Absolutely. It is definitely a skill. Well, Dr. Street, where can our viewers go for more information or to make an appointment?
So they can go to holstonmedicalgroup.com, and they can call our office. The phone number is 1-877-HMG-1213. As I said, we can get you in really quickly. We're also offering telemedicine services, so these are really great appointments types that we can even do from home over your smartphone or the internet. So that is an option as well.
And I love that you guys are really reaching out to the community, knowing the needs right now. You've also got this blog, which is full of great information on different topics.
And that can be accessed online as well at holstonmedicalgroup.com.
All right. Well, Dr. Street, thank you so much for taking the time to join us. Such an important topic today.
Absolutely. Thank you for having me.
All right. If you would like more information, don't forget you can always sign up for the blog. Very easy, great information. You can do all of that at holstonmedicalgroup.com.
The preceding portion of Daytime Tri-Cities was sponsored by